Hi there. Okay, so you're here for your eye exam, I understand. Great. Okay. So why don't you tell me the reason for your visit today? Okay, so you're having some flashing lights in your vision? Okay. And also some floaters? Okay. And how long have they been there? For approximately 3 days? Okay, and are they there all the time or do they come and go? Okay, so they're constant. And which eye? And your floaters, are they on the top, on the bottom, on the sides, or are they? Okay. And how big are they? Do they look like bugs, flies, bees, mosquitoes? Small little spots. Are they gray or black? Okay. All right. And have you ever seen these before? This is a new issue. This is a new issue? Okay. Okay. So, what we're going to be doing is I'm going to have to put some eye drops in your eyes. And these eye drops will be dilating your pupils. Have you ever had that done before? Okay, yeah. Well, dilation is a procedure that we're going to do in order to evaluate your retinas, okay? So with your symptoms that you're describing today, there may be a retinal problem. So we're going to go ahead and find out exactly what's going on. So once I put the drops in, after they activate, your pupils will enlarge, and we're going to be able to take a look at your retinas. So let me just show you this here. Okay, so right here is the retina in the back of the eye. And the drops will go, of course, into the eye, and it'll affect the pupil, which is right here. So the pupil will expand, and I'll be able to take a really good look at the entire surface of the retinal tissue. Okay? Okay, so let's go ahead and start with our first eye drop. Can you look up towards the ceiling for me? Okay. Great. Now just look all the way up. Good. Here's a tissue. Here's a tissue in case you need to wipe the excess. Okay. And then let's do the other eye. Go ahead and look all the way up. All the way up, all the way up. Good. Open your eyes. Good. Okay, great. All right. So now you're going to have a seat out in the waiting area. And in just a few minutes, I'll be back and we'll do your exam. Okay. Let me take a look and see if your pupils have dilated. Just going to use this light here. Okay. The right eye looks like it's dilated. Yeah, you're fully dilated. I'm going to be using this lens. And this will allow me to view the back of your eyes. I'm also going to be using this lens. This one's a little bit bigger. And this will allow me to get a slightly different view. Now, first I'm going to turn the lights off, okay? So it will get very dark in here. And I'll be asking you to look in different directions around this room. I want you to keep your head straight and just rotate your eyes in the direction that I ask, okay? All right. Okay, go ahead and look up. Now look to the up and right. Good. Now look up and left. Good. Now look to the right-hand side. Good. Now look to the left. And now look to the down and right, bottom and right. Good. Now look straight down. And down and left. Great. Okay. All right, so let me turn the lights back on here. And we're going to do the different ones now. Go ahead and look up again. Now look up and to the right. Good. Okay. Okay. You did a great job. And now we're going to talk about what's going on. So let's look at this pamphlet. Let's go over here so that we can have a really good look at it. And we'll discuss your findings, okay? Okay. All right, so as I explained earlier, the retinal tissue is very delicate, okay? And sometimes the retina can detach from the back wall of the eye. And, well, actually, let's see here. Let me see that there's no graphic for that, but Just take my word for it. What's being shown here is the vitreous detachment. And that's actually what you have today. So you have a vitreous detachment, which is why you see flashes due to tension from vitreous pulling on the retina. And because it's actually detached from the back wall of your eye, that's the reason why you see floaters. Flashes appear as flashing lights or lightning streaks in the field of vision. Flashes are caused by the vitreous gel tugging on the retina. If the gel actually separates from the retina, it's called a PVD, posterior vitreous detachment. Flashes of light may appear periodically for several weeks. As with floaters, flashes are usually a result of the aging process and do not indicate a serious vision problem. However, flashes which appear along with a large number of new floaters or with a loss of part of the vision may indicate a retinal detachment. So that's why I wanted to do this test on you today. And luckily you do not have a retinal detachment. If you did, you would have certainly had to treat that right away. Okay? Remember that prevention is the best medicine. Although floaters and flashes are usually not considered serious vision problems, one should have a complete eye examination to determine their importance. In most cases, treatment is not necessary. However, early detection and treatment of serious problems such as retinal tears can prevent permanent vision loss. Let me show you a graphic here. This is the back of the eye. This is the retinal tissue. And here's the optic nerve. This up here is a retinal detachment. Notice that it looks almost like a curtain coming down, or almost like wallpaper that's separated from the wall. This is a very serious situation. This can blind you if it goes all the way down. And if it's not repaired in a timely fashion, the retina will lose its blood supply and it'll atrophy and die. Now, as you can see here, we have numerous different issues that can occur in the back of the eye, which you won't really know are there unless you have an eye examination. So we can see things like choroidal melanoma. This is also a deadly condition. This can kill you. So you want to make sure that you do not ignore issues like that. Bear tracks. In some cases, these are associated with people who have colon cancer. So these could be an early marker of somebody who is, at risk for colon cancer. Exudates in people who have hypertension or diabetes. And there's a bunch of other stuff, which we won't go into all of them. But here, there's a floater. You can see that right there. There's a tear. The retina can also tear off of the back wall of the eye before it detaches. If we find it in the torn stage, we can do a laser surgery that will seal it back in. So I'm glad to give you the news today that it was just a PVD, which is the lesser of all the evils, and you're going to be just fine. But I would like to assess you again in about 3 months. We'll do another dilation test on you, and we'll find out if anything has occurred. In the meantime, if you notice any worsening of your symptoms, I would like you to let me know right away, and we'll get you right in. As you know, we're pretty flexible with our schedule. If there's an emergency, we'll definitely try to take care of you. So do you have any questions about any of these conditions or about your exam today? No? Okay. Well, it was really great to see you. I'm glad it was good news, and we will talk soon. Okay, thanks. Bye.